Hi, my name is Dr. Suzanne Bender, and I am here today as a representative of the grassroots organization Opt Out Newton. And we are a group of parents, educators, community organizers, physicians, and students. We're here today to ask the Newton City Council to let the Newton voters decide on retail marijuana sales in our city. I've been a resident in Newton for 18 years. I'm a Newton parent. I'm a child psychiatrist. I have a private practice at Newton. I also work at Mass General Hospital. I'm an assistant professor of psychiatry at Harvard Medical School part-time, and the other part of the time I'm working in Newton. First, before we discuss what we're asking today, we want to review some details of question 4, which are important to review. And so the first is that question 4, which was developed with a lot of input from the marijuana industry, is fundamentally different than the legalization questions for the legalization of marijuana in Washington State and also in Colorado. So in those states, after voting to legalize, every community decided whether they wanted to opt in to retail marijuana sales. In Colorado, only 30% of communities decided to do this. In Massachusetts, a vote of yes for question 4 meant that every community was mandated to opt in to marijuana retail sales, and you would have to vote to opt out. So in our case, we're currently mandated by state law to have at least 8 retail marijuana dispensaries, and this number is a result of the fact that we have around 40 liquor stores. This is 20% of our liquor stores. When question 4 was written, there was a worry that towns were ceding control to the marijuana industry by voting yes for legalization and for decriminalization. And the response was that embedded in question 4, and to support local control, question 4 allows towns to vote to opt out and regulate use. It's our legal right as any community in Massachusetts to explore both. They did make it difficult if your town voted yes to opt out because they wanted to protect their interests. But there is a method to opt out, and it requires a ballot measure where then the Newton voters vote to whether we want retail marijuana stores, and a city council vote as well. So what we're asking for today is that the city council support a ballot measure that will let the Newton voters decide in November if we want retail marijuana shops in our community. There have been at least 26 city or town councils that have already voted to address this, and these are in towns that voted yes to question 4. And these towns councils have allowed their constituents to vote on this issue, recognizing that this right is embedded in state law. There are 3 ways in Newton to develop a ballot measure for Newton voters to vote on an issue. The first is that there's a citizens petition, which is what we did, and then the city council approves this ballot measures for voters to decide an issue. The 2 other ways, one is that citizens gather 6,000 signatures and brings them to the city clerk for a ballot measure, and the city council approves this measure, and then the ballot measure is voted on by the voters in Newton. And the final method doesn't require any city council approval, but requires 9,000 signatures for Newton registered voters to support a ballot measure. So we want to say today that the requirement for 6,000 signatures is when we've talked to some counselors, we've heard that the way to get this measure on the ballot is to gather 6,000 signatures is very unreasonable. First, every other town in Massachusetts has allowed this vote to happen because it's embedded in state law as a community right. Second, let's look at the requirement for 6,000 signatures in contrast to other situations where one needs to gather signatures. To get one's name on the ballot to run for the Newton City Council, you only need 150 signatures. In Acton and Belmont, citizens collected signatures. They didn't even need to collect them, but they did it to bring it to the City Council. And they only needed 146 or 230 to support the idea of an opt-out ballot measure for their community. For Joe Kennedy to run to represent the 4th District of Massachusetts, representing 700,000 people, he only needs 2,000 signatures. So it seems utterly unreasonable that we are required to get 6,000 signatures to support a ballot measure that is already embedded in state law as is our, as a right for every community. It was the intent of the law that every community have this opportunity to vote on opting out. Opting out of retail sales does not affect an adult's right to use marijuana. Some people have said to us that we're acting to ban marijuana. And we want to say we support legalization, we support decriminalization. With opting out of retail sales, an adult right to use marijuana recreationally is protected. Medical marijuana use in stores are protected. An adult right to grow marijuana is protected. When the state allows home delivery, that would be allowed in Newton. So currently, of the 8 required locations, there are 3 proposed sites, and they're near family-friendly areas, and it seems to us that it's pretty unclear if residents can influence the placement of these stores because there are already lawyers and a lot of money going in to develop these locations. And these locations are family-friendly locations in Newton. One is Murray's Liquors in Newton Center. This is by Bill's Pizzeria. This area is swarming with elementary, middle school, and high school kids on every early release. The former South Pacific restaurant location in Four Corners is right near a park. It's on the walking route of the Zervis Elementary School children. And the former site of the Green Tea restaurant near Route 9 is right near a residential neighborhood. And yet it's unclear if residents can protect their area if, they really feel this is a family-friendly area. It seems these locations are en route to become retail stores. So supporting legalization does not mean that a community supports commercialization. 26 towns have already had a vote, and these are towns that voted yes on question 4, and with their ballot measure, 23 out of 26 have voted to opt out, and we have the list here. Around 54% of Massachusetts voters supported legalization. But when we bring the specific question of whether you want retail marijuana stores in your community, 60% of the voters in these yes towns have voted to opt out. In fact, of the 26 towns that have voted on opting out, 88% have voted to opt out. So we sent out a Google survey, and we sent this out via multiple listservs and crowdsourcing different email groups we had in different Newton towns and villages. And one question we asked, we got 230 responses of registered Newton voters, was did you vote in favor of legalization in 2016? And we had 53% yes responses, 47% no. What's important here is that in 2016, Newton voters voted in favor of question 4 with 55% yes and 45% no. So we considered that our Google survey was representative of the same sample of a sample of Newton voters who voted to legalize in 2016. So then we also asked, when you voted on marijuana legalization, were you aware it would require Newton to allow at least 8 recreational marijuana establishments? And 79% of the respondents said no. And then we asked, do you think Newton voters should be able to vote on whether or not to opt out of allowing recreational marijuana stores? 69% of the respondents said yes. Finally, we asked, if a vote were held Would you vote for Newton to opt out of allowing recreational marijuana stores? And 59% said yes. So this is right in line with the rest of the state statistics for every community that has voted to opt out. If the question is whether Newton is different than the rest of the state, from this representative sample, our answer is no. Let's see, I'm trying to get the next slide. Here we go. So we believe it's incredibly important that the Newton voters decide what's right for Newton, not the marijuana industry. There was so much money spent promoting question 4. 4.3 of the $5 million promoting question 4 was from an out-of-state, Washington, D.C. based pro-marijuana super PAC. Remembering these commercials, they all talked about decriminalization and legalization, but there was never a mention of the mandate for every community to sell retail marijuana. When we look at the much underfunded concerns about question 4, the sources were Massachusetts Residents, Partners Healthcare, that's Mass General Hospital, Newton Wellesley Hospital, Brigham and Women's, Mass Medical Society, and the liquor industry. So the tax benefits of sales of marijuana are negligible. There are conversations when people say we need to take advantage of this revenue of the marijuana industry coming into Newton. It's going to, give us so much money, and that will be so helpful. But in fact, a March 2016 report from the Special Senate Committee on Marijuana, specifically looking at this issue, found that the tax revenues and fees that would be generated from legal sales may fall short of even covering the full public and social costs. So we did some back-of-the-envelope calculations to take a deeper dive into this. So an average Colorado store makes about $2.5 million in sales per store. We're taxed very low rate. This is, again, the marijuana industry very involved in the writing of question 4. So that's $75,000 per store. 8 stores lead to an annual income from the marijuana retail stores of $600,000. So we need to see, would this money help Newton? Well, in fact, if we look at how much Amherst, Massachusetts, a much smaller town, is anticipating spending to protect its community and public health with retail marijuana stores, they're anticipating that they will need to spend $550,000 for 2 new police officers and 4 new EMTs. So the $600,000 for marijuana sales in Newton, which is 0.15% of the Newton budget, would potentially not even cover the EMTs and police officers we would need in a much bigger city. So it's not clear that Newton will even break even if we have retail marijuana shops. Some people have said to us, this is an example of NIMBY. This is not in my backyard, and we have a very specific answer to this. It is the legal right of every community in Massachusetts to decide what's best for its community regarding retail marijuana sales. Over 80 towns have already opted out, and these towns range in demographics and size from Weston to Methuen to Revere to Lawrence to Lexington. It's the choice of each individual community to decide what's best for its own community. Why is a marijuana dispensary more concerning than a liquor store? There are 4 reasons. One is there's going to be increased secondhand smoke with the smell of marijuana permeating down the street, down the sidewalk by any store. So Bill's Pizzeria, you will be smelling the marijuana from Murray's Liquors. This is going to change the whole family-friendly atmosphere of that area of the city. An all-cash business model, because that's currently how it works since federal government still does not support marijuana sales, invites increased crime. Newton was known as one of the safest cities in America just a few years ago. What's going to happen when we have multiple stores bringing in loads and loads of cash? It's inviting people. It's like bees to nectar in terms of crime. With increased exposure in the local community, marijuana is normalized for young people. We'll talk about that more in a minute. And we are inviting impaired drivers to our community. So commercialization leads to normalization, promotion, and increased use. So as a child psychiatrist, this is how I became involved in this, campaign, and felt very concerned about our youth. Young adults and teenagers are the most vulnerable in terms of addiction. The young brain is primed for addiction in a unique way, and 1 out of 6 young marijuana users becomes addicted. And so we worry a lot about binge drinking, and that is, concern with young people. The way that marijuana addiction works is different. First, a teen or young adult starts smoking on the weekends. Then they're smoking 2 to 3 times a week. Then they're smoking every morning. Then they have a pen, and they are smoking in class or, on breaks, because it's sort of this very, very tiny thing. Nobody can notice it. Imagine if we knew of a substance. We don't hear of kids taking shots before school, taking shots during school. There is this unique addictive quality to marijuana that needs to be recognized for the young person. Those who start under age 15 are at increased risk of dropping out of school and for dissatisfaction with their lives and relationships. Young adult chronic use changes gray brain matter, so this affects motivation, attention, and emotional development. There's an increased risk of psychosis. There's a diathesis stress model with schizophrenia. What this means is if a person is already wired to be at risk for schizophrenia, there is a well-researched association that if one uses marijuana with this wiring, it can trigger the schizophrenia. That's a lifelong, chronic, devastating psychiatric illness. Long-term use can increase the risk of depression and anxiety as well. So, one might say, well, legalization has happened, and so we need to pay attention to this, but, why does this matter? Well, the reason it matters is because when there was a Healthy Kids survey in Colorado in 2015, and they looked at the counties that had the most increased use, these are the counties in dark purple, where the youth, there was an increase up to 30% of marijuana use after legalization. Those counties with increased use are correlated with those counties with increased store. So when there's more marijuana, more kids use. So to protect our youth, our teens, and our young adults, it makes sense that it is a little harder to get to a store and that it's not right in town. And, I know that you have to be over 21 to buy, but just like alcohol, there will be a way for kids to access it if it's close by. They can ask somebody else to buy it for them. So marijuana use also impairs driving. Marijuana-related traffic deaths increased an average of 48% in the 3 years following legalization in Colorado. In Washington state, it increased 122% for those who had THC in their blood. Driving after using marijuana approximately doubles the risk of a collision. And when we think about it, there's so much education about drinking and driving, designated drivers, how much is, safe to drink if you go out to dinner and then drive home. And yet there's no information on this regarding marijuana. Colorado Public Health says any amount of marijuana consumption puts you at risk of driving impaired. And law enforcement doesn't have any breathalyzer equivalent to identify these drivers. Meanwhile, all of these towns around Newton have voted to opt out of retail sales. So these consumers will be driving to Newton to buy, and at least some of them will be using and driving home high. So we don't want to become the regional supercenter for marijuana sales. On this home-drawn graph, we have all the towns and cities that have voted already to opt out in red. And then we also have the towns and cities that are on a moratorium in orange. So they may absolutely vote to opt out in the coming months. The towns or cities in white, they have opted in, like Boston or Brookline, or possibly we don't have information, such as Dover. But we can see that this aqua city, Newton, is going to become the go-to place for people who need to buy retail marijuana. And when they drive home, some of them high, it could, endanger our pedestrians, our children, our bikers, and other drivers. The precautionary principle is the idea if there's a very controversial topic, such as this one, that it makes sense to act to do the least harm. And with these concerns that we've reviewed, it seems that the best thing to do, at the very least, is that we bring this back to the Newton voters to weigh in on the issue. It is our legal right as a community to vote on whether we want recreational marijuana in our city. This is our only chance to opt out, and that after the stores are here, they're here. But we deserve the chance. It was the intent of the law that both voters could vote on opting out and that there would be regulation within a town. It wasn't the intent of the law that you had to immediately go to regulation. All the other towns have had the opportunity to vote. There's so much money in the marijuana industry. We want to avoid that there's any concern that money is driving this decision of whether we have retail establishments in our city. Currently, there are 2 city councilors who have a family member who's actively engaged in developing South Pacific as a marijuana establishment. To avoid any concern about conflict of interest, we need the City Council to support this ballot measure, bring it to the Newton voters to decide what's right for Newton. There we go. It's the last slide. So I'm now going to hand off to final words to Dr. Michael Jelinek. Dr. Jelinek was the chief of MGH Child Psychiatry for 32 years. He was the president of Newton Wellesley Hospital from 2000 to 2012, and he is the consultant to many Massachusetts school districts for decades. This has included Newton. For those of you who are listening at home, I'd like to thank you for taking the time to watch this presentation. If you have any questions or want more info, please contact us at optoutnewton.org.